Hello, my friends. I want to tell you about today's clinic case. The situation is standard. There are some difficulties, and now I want to show it. Just a simple presentation about the implantation of teeth. The patient came, the lower jaw, there is a small root that remained. I recommended that the patient leave it until the implantation. That is, do not remove it immediately, but remove it only at the time of implantation. Why, I'll tell you a little later. The adjacent teeth are in good condition. We treated them and everything is fine with them. Our work area is this part. We need to install 2 implants here. What we will do. Here on this slide, I show the resorption of bone tissue. We must understand that the place where the tooth is removed, the left tooth is absent. Over time, the bone tissue decreases. It decreases in thickness and height. Why did I ask to leave a root here? Even a small tooth, no matter how beautiful or ugly, does not allow the bone to decrease in size, does not give the bone resorption. There is no root here. And you see how much the bone has disappeared. Here, under implantation, you need to take either a smaller diameter or perform augmentation of bone tissue, and soft tissue, of course. What I showed, at the place where there was no tooth for a long time, the bone has gone. And at the place where the root is present, the bone is in stock. When the doctor tells you to remove the root, first think about whether you will put an implant there or not. If you plan to put an implant, do not remove the root. We do one-time, one-stage implantation. Here we did. The patient came, today we did the anesthesia, and only then began to remove the root and install the implant in its place. The difficulty was that there was very little bone thickness. Here I showed another option of resorption. When the bone has gone, it should be level, but over time it has gone in height. Here we see the situation after the implantation. Everything is beautiful, no bleeding, no bleeding. Everything is beautiful, clean, everything is fine. And so our implants are visible, which are located in the thick bone. Here I put a photo with an x-ray image. Everything is fine, everything is fine. In this case we put a plug. I want a small amount of bone tissue on top. In the future, according to the plan, we will add soft tissue. We will take a transplant from a beaver. We will plant it in this area so that there is a lot of hair, and it is thick. Here we will work with this point. Therefore, install implants with a high quality and understanding of the matter, and you will be fine.